I'm Dr. Ram Chidambaram, consultant shoulder upper limb surgeon, from founder director of Chennai Upper Limb Unit, a dedicated center to care for patients with problems affecting shoulder, elbow, wrist, hand, an exclusive center of its kind in India. About 50% of the elbow surgeries I do are revision. That means the patients had some treatment elsewhere, but they presented with pain, stiffness, and difficulty in moving day-to-day tasks. So why we are bothered about elbow? Elbow is the special complex joint. You don't think like it's a simple hinge, not like knee joint. It has got multiple movement like bending and straightening as well as forearm rotation. And the purpose of the elbow joint is to keep the hand in space so that you can enjoy day-to-day life, sports, leisure, whatever you want to do, you need the elbow. The elbow is stuck in a position, you will have handicap. Same way, if you are not able to bend also is a problem. And the elbow is a complex joint. It has got bones articulating with ligaments, nerves going close to the joint. So it can be affected in varieties of problems. In childhood, fracture. The children break their elbow. And in adulthood, we have fracture, dislocations can happen because of fall, or most commonly in India, road traffic accident. Next, you could have affection with sports injuries. Sports affection is increasingly popular, so there is more of overuse injuries as well as acute traumatic event can happen during sports. Elbow can be affected by arthritis, it could be age-related osteoarthritis or rheumatoid arthritis, and tumors, infection. So there are a lot of problems the elbow joint can be affected, but there is very little awareness of the complexity of the elbow joint as well as the treatment options available for these conditions. And so the patients often get to see bone setters or general physiotherapists or general physician or general orthopedic surgeon, and sometimes they may not get the best treatment and they might suffer in silence. And at a lot of surgical cost, they will not be able to do what they wanted to do. So we have why I am talking about elbow because I was fortunate enough. I spent about 12 years in UK as well as I traveled overseas across. So happened to have excellent training in elbow surgery specifically from none other than Dr. Sean Wood. It's called from Mayo Clinic, and my mentor Dr. Daniel Mock from UK. So I was fortunate. I learned it. I'm practicing it, but there is little awareness in India among the general orthopedic community about the complexity of the elbow problem. Now, why exclusive conference or meeting on elbow joint? Because the elbow joint is treated as one of the many joints in other conferences. We have trauma conferences, keyhole surgery conferences, joint replacement conferences. The elbow will be talked about for a session or for off day, so not much is discussed. So we would like to bring the focus on the elbow joint. We would like to have a dedicated conference. This is the first time ever conducted in India. 3-day meeting exclusively talking about the problems of elbow joint and the treatment options available to treat many conditions we see in elbow. It could be conservative treatment, physiotherapy, good rehab advice, or could be orthobiological injection, keyhole surgeries, elbow joint replacement, partial or total, ligament reconstruction, fracture reconstruction. There is a wide range of options available, but we wanted to improve the awareness of the elbow joint among the public, among the general doctors, because if the public and the general doctors are aware such a solution exists for elbow problem, then the patient will get automatically seek for the best treatment options available. So that is why we are here. We are very grateful to our international faculty. The first time we have 6 international faculty for this meeting. We have Dr. Greg Bain from Australia, Dr. Lee Van Rensburg from Cambridge, UK, and we have Dr. In-Ho John from South Korea. We have Dr. Radhakan Pandey and Dr. Havinder Singh from UK, Dr. Melanie Amarasuriya from Sri Lanka. And like Dr. Greg Bain and Dr. Lee Van Rensburg and Dr. In-Ho John, they are prolific elbow surgeons. They do around 500 to 1,000 elbow operations a year. They concentrated, they've done a lot of research. So we would like to learn from the expert. Especially we would like to transfer the knowledge on this elbow joint, its anatomy, the complexity of the injuries, what treatment options are available, etc., to then pass it on to the next generation of orthopedic surgeons. So we have over 100 orthopedic surgeons who traveled all over India to attend these conferences here in Chennai today. Today and tomorrow, we are going to talk about the anatomy, the biomechanics, the clinical, how to examine the elbow, when to do the investigation like MRI scan, CT scan, how to interpret, how to assess an injury, what is the best treatment available. Be it a fracture, instability, dislocation, or arthritis, or nerve compression syndromes, or infection, or tumor, the entire range will be discussed. Keyhole surgery and elbow replacement will be discussed tomorrow. Icing on the cake, on Monday, we have planned a cadaveric skill course in collaboration with Madras Medical College. So it's a collaboration from private sector to a government medical institution to conduct the cadaveric training course in Madras Medical College. The faculty, we are going to demonstrate the approaches to elbow joint and demonstrate the key surgical procedure so that the delegates who are participating will learn and practice the best practice of elbow surgery, which will benefit the future of Indian patients, public and doctors. Depends on where we practice, because in my practice the patients come seeking attention after mostly having had some treatment or failed treatment elsewhere. So basically majority of patients go to general orthopedic surgeons or physiotherapists or general doctors first. If they know where or what could be done for the elbow injury, then they can be redirected to the expert. But as such, elbow experts are very less. We have our international faculty as well, but they are limited in number because of the lack of opportunity of training. And that is the key reason why we are here to teach. If we teach 100 orthopedic surgeons what is the best in practice of elbow surgery, they will be teaching. Majority of medical colleges, professors are here today, so they will teach their students, so that good practice will prevail and ultimately the patients will benefit.
How the patient take elbow very seriously since
the problem is, good question. If the knee problem, they get immediate attention because they are not able to walk, mobility is restricted, etc. But for the elbow, sometimes they may not be aware what is possible. So here we say what we call terrible triad injury. Whole morning we talked about it. So the elbow fractures, dislocate, ligaments torn, very bad shape. But if you just put in plaster or bandage, they get stiff. If the stiffness of elbow is a big problem. If it is stiff, the patient may not be able to eat food. They go like this. Or if they want to reach for the right side, if it is a non-dominant hand, they want to do personal cleaning. If the patient is not able to straighten the elbow, they are handicapped. But they come late. If they come late, yes, still possible to do some reconstruction, complex surgeries. But when they come early, they can get the best treatment. Nowadays, best treatment are available. Make the elbow stable and move early. If the patient fractures the elbow, we can fix it successfully and make it move the next day. And that is where the future direction of teaching is going to be.
So currently, general tips for patients to safeguard the elbows.
Well, I can't say don't travel and don't have an accident, but in elderly age group, sometimes the fracture happens because of osteoporosis. That could be probably checked. You want to answer that question, Lee? Any particular precaution for...
I don't have anything particular that will be able to stop you having an elbow injury. Keeping your bone stock as you get older, good. Preventing osteoporosis, all the sensible health guidance. But I don't know anything in particular that can stop you from having an elbow injury.
Okay.
Sir, currently, what are the advanced technology for the elbow? What you faced currently through the process, what is the main issue in the elbow surgery and what is the advanced technology?
Yeah, do you want to answer that?
One of the key things about this whole meeting is to understand how the elbow might fracture or how other injuries would occur within the elbow, the ligaments or the soft tissues associated with it. So we've spent a long time discussing that, how to interpret the scans, and then to apply that at the operating table to try and get the best outcome for our patients. We've also discussed in a lot of detail how to optimise how it's held so that we can actually get the patient moving quickly so they can get back to the things that are important for them, so that they can, whether it be their sport or just their household duties or back at work. So I think there's the contributions that we've discussed up to now have been important, and we're going to discuss more about like arthroscopy, the telescope, and joint replacement. So it's really covering the whole spectrum of elbow problems.
Yes, sir, you travel across the overseas actually. Compared to India, what are the main activities to the elbow problem? And compared to other countries, please say about the India.
See, because I practice, I'm not really Indian. I practiced in UK for 12 years. So I know the UK NHS practice. If the patient has an injury, they go automatically to NHS hospital. They get addressed. There is a system. There is a system in place to filter. So the common injuries are treated by general orthopedic surgeon. If the patient has got complex issue, they go to Lehman-Densberg. Like that. But here in India, the problem is the patients go to the local orthopedic center or local care provider. So that is the reason why we want to increase the public awareness that there is something more available. But nowadays things have changed. Often the patients find me also through ChatGPT. They put their problem. Then they will be able to find out who or where the treatment is possible for them to have.